Hello, and welcome to this week's edition of the Green Wisdom Health Show. I'm Janet Lewis.
And I'm Dr. Lewis.
And we're here to pep you up and inspire you about your adrenals. Today's show is called Common Signs of Adrenal Insufficiency. And we chose this topic because, well, maybe we're going through a little bit of this ourselves and thought, well, we could talk to you about it and educate you and give you hope about how adrenals affect energy and stress and mood and being tired, and what can you do about it to make it better. So, Dr. Lewis, would you entertain us today with your knowledge and expertise in this field?
I love the way she sets me up to be smarter than I really am, and I'm too tired, so that's the end of the show. We chose that just because, as Janet's kind of implied, we're going through a lot of changes, and even good changes can be very stressful. Anybody that's had a baby, got married, et cetera, know that even positive changes can put a lot of stress on the body. Well, we're going through a rebranding, and you'll find out soon in the future we're changing some products. Most of them are at least as good, but at a lower price. Many of them are better. Most of them at a lower price. Some of them you just gained 10 extra capsules or 40 extra capsules. There's some pretty good changes. We've already had people that come in here locally as we begin to replace some of the older ones with rebranding. It's like, oh my God, I'm saving $7. Oh my God, that one's way less expensive. Oh my God, you're getting more pills there. Oh my God, that's twice as strong. So just bear with us, and we're having people that's running out of products, and there's some on back order, so just be patient. Don't let your adrenals get in an uproar.
However, on the website, I have put a new search bar in place so that things are easier to find. That being said, the companies that we were previously carrying products for, one in particular does not want their name mentioned on our label at all. So
even though we're getting some of the products from them.
Yes, the products are still coming from them, but they don't want us referencing their name on it, so they're not going to say replaces, SBI Protect or something like that. It'll actually just be our name, and it'll say same great formula, new name. So those are the same things. It's just going to be very difficult to find for a little bit, and we do appreciate your patience. You may email me all you would like or call, because I'm getting a lot of them now, and I'm happy to answer them because you're going to be lost as we are. So we're going to help your adrenals now, because we don't want to put you through any more strife than what you probably already have in your own life. But we want to tell you a little bit how to have a little bit more energy and go through some things with ease.
And this was not a negative thing that, when it transpired, it was actually because there's so many people listening on the podcast, and they're buying products even without getting the lab work, hopefully through us helping them and helping them make a better decision. But these companies wanted more of a doctor-patient relationship. You can't always maintain that, because we have so many people out there like you that are happy with the results you've got, and you're telling your family and your friends, you're sharing the podcast, and we're incredibly grateful for that. So it goes back to, and I'll get into the adrenals in a minute, but it's about being happy, and it's about being optimistic. It's about having a healthy, happy life, and we choose that with the thoughts we think. And I've seen some post, some I posted, some other people posted, and people say, but I'm a victim and you're blaming the victim. No, if you're that victimized and you're that depressed, please just ask for help, because we all have different bad things happen in our life, but it's how we handle it. And it's a proven fact for those of you that like science, that when you're happy and more optimistic and more positive, you actually become more successful, and that counts in job security, making money, but more importantly, it has to do with your state of mind and your health, and what you show your children and your grandchildren, because they kind of don't listen to what you say. They watch what you do. So, optimistic people that deal with us always get better results than people that are pessimistic. So you can look at the problem and talk about it, or you can look at what you hope to achieve. Those people that look for what they hope to achieve, they have a goal, they're always much more successful. So that's the reason we talk about adrenal fatigue, because this is a good change, and it is a positive change, but it's stressful. So I'm an expert on adrenal fatigue because I finally maybe worked too much, but certainly played too hard, and my adrenals have gone into adrenal fatigue. My cortisol went down to a 7, which is pretty low. That's stimulate with caffeine all day, which we'll talk about. There's all sorts of symptoms that can be associated with adrenal insufficiency or adrenal fatigue. But keep in mind, these list of symptoms very many times can go with other lists like thyroid issues, because the adrenals and the thyroids play off each other. If one goes down or is going down, the other one tries to step up to take the place, and that is included with the hypothalamus in the brain. And last week we didn't get too deep into it, but the ones that have diabetes or prediabetes or metabolic syndrome are very much stress in their body, and the adrenals have to take the place of what's missing otherwise, because the adrenals put out not just cortisol, but they put out cortisone. I know everybody's familiar with that. They put out aldosterone and androstenedione, and they put out DHEA, which I love to see that on lab. And so it's a really important organ that's pretty much overlooked. So the symptoms of insufficiency, and although it can be other things, but many times it's associated with the adrenals, or they're under stress. It can be just chronic fatigue. People say, but I have chronic fatigue syndrome. Well, that can be a virus that's taken over. Your immune system's taken a hit. But I promise you the adrenals are involved. It can be muscle weakness, especially if it's prolonged. Changes in appetite. Most of the time that's loss of appetite, although under stress I eat more, and I eat very incorrectly. So it can be either way. It can be weight loss or weight gain. It can be digestive issues. That can be abdominal pain. I just got an email about that. Abdominal pain, nausea, vomiting, diarrhea. Well, that goes back to the IBS and some of the things we have that allows your body to work with that. But again, the adrenals are always involved, because they're ones that try to step up, put out excessive amounts of these hormones so that your body can use it and protect you. Janet, I think typically has lower adrenal output because she has a tendency toward low blood pressure. Because of that, she craves salt. And if you're going to do the salt, do the Celtic or Celtic Himalayan pink sea salt, because it has a much better mineral profile and is processed differently than your regular table salt. Some of the other possibilities are mood changes, irritability, and depression. So if your wife is saying something about you, don't tell them that the irritability is because of her adrenals. Just take the hit, man, and say, okay, it's because I'm not being a good husband, and that's why you're irritable.
I somehow feel like this is wrapping its way back into some kind of conversation we've had recently. But go ahead.
Well, I don't remember it, but I'm sure Janet will tell me later. Headaches. When your wife says, I don't feel good, I have a headache, it's probably the adrenals, or maybe you don't take a shower and brush your teeth. I don't know. But headaches can be a very common symptom of adrenal insufficiency or exhaustion. The cravings for the salty foods, like I mentioned, the salt, starts out, usually it's low blood sugar, and normally it will turn later and get into high blood sugar, going into the metabolic syndrome and diabetes. Trouble sleeping, and that's one of the worst things we have to deal with, and I told a lady that yesterday. No matter what she does, she cannot sleep. We're experimenting with a new one of those, and I finally got to the point that I don't even take anything to sleep, and there for a long time I did. So it is a fixable problem, the sleep issue.
Isn't that the most horrible thing, though, is when you don't sleep, and then the whole day is just... you're just trying to get through it, and like you said, have coffee and whatever you can to just try to stay awake, knowing that you're not really functioning at 100%.
Yeah, with all the stress and that's going on in America today, I think it's very important that the ones that can think different or think more clearly, I think it's more important for us to step up and be the happy one, step up and be the healthy one, step up and be a good example, because it does make a difference. And I certainly don't think the problems are as bad as you see on Facebook, because I see, at least in my world, I see more people being courteous, and this is not a race thing. It's not, sexual orientation. It's people are beginning, I think the pendulum is swinging back to we're being nicer and kinder to each other. We're beginning to stick together and seeing each other as humans that deserve to be loved and deserve to be happy and deserve to be healthy. And if you feel like you've been beaten down by some situation, you don't have to be a victim. All you have to do is reach out for help, because there's plenty of people out there that are more than willing to help, because people like Janet and me, we kind of get our kicks. We get our pat on the back from helping people. So please ask for help. And we've gotten a lot of that, like Tawny. She trusts me with her children. That's a big deal. I take that as quite a blessing, and I'm humbled by it.
And Michelle, who just sent in a friend of hers into our store today, the sweetest little lady, came in and talking about adrenals. And she said, I just had lab work done, and they did 2 panels of lab, and they couldn't figure out what was wrong with me, but I feel like I'm disconnected from my body. My legs feel weak and shaky. I have no energy. I feel dizzy. But they said that my iron is fine, and my kidneys are fine, and my glucose is fine. And they told me my vitamin D2 was low, and I'll let Dr. Lewis explain that one. But she said that Michelle had sent her to our office and said, please go down there and see these people, because they can tell you so much more. And she said, I don't know what you can tell me, because the doctor said everything looked great. And I said, well, what were your cortisol levels, your adrenals? And she goes, I don't know. They didn't run that. She goes, but I can tell you I've always had really low adrenal function. And I said, and, well, you could have that. It could be an iron problem. And she goes, no, they said my iron was fine, but I might be dehydrated. And I said, well, you know what? I said, they didn't run a stored iron. And the stored iron, we found many times people are actually anemic and feel the way she did. And then they'll drink water, or they'll be dehydrated. And on their lab, it looks like their iron is fine because they're dehydrated on the regular CBC panel. But when you get a little bit deeper, which the insurance companies tie the doctor's hands and don't allow that, where we can, because it's a cash price, we can see, hey, they're actually really anemic. Or they run their 3-month blood sugar, and it's like, hey, they're actually bordering on being a diabetic. And that's missed on plain glucose. So, when Dr. Lewis talks about these adrenals, they can be high, they can be low. You're just going to feel bad either direction. So I thank you, Michelle, for bringing in people to us to help make their lives better. That little girl was so grateful. She just kept turning around and she just kept going, wow. Just wow. I just never knew. She said, and then she came back in and said, so I've started drinking water, and I decided to put Pedialyte in my water. And I said, what kind of water are you drinking? She said, I'm drinking Ozarka. And
now
I
we're going to
said,
get letters and lawsuits from Ozarka, so
I'm
be
not
careful.
saying anything bad about Ozarka. I'm just saying that would not be my choice.
It comes from, partially, comes from a spring in Wood County, Texas, and I promise you, they ain't no clean springs in Wood County, Texas. Been there, done that, on a deer lease there for probably 10 or 15 years. Don't drink. That's some nasty stuff.
Well,
Sabine River runs through it.
Ozarka would have you be portraying as mountains coming out of clear streams, and I have not seen a mountain in Texas. If y'all haven't been to Texas, there's not those kind of mountains here. You're thinking more like Arkansas, but
yeah, some of their mountain water is much more clean. And Brandy, sorry, Janet, Brandy ordered some pH test strips, so we're gonna be reporting on that pretty quickly.
Well, and so I told her, I said, try to get reverse osmosis. She goes, I don't even know what that is. And I said, well, read on the labels on the side of the bottles, and they will say filtered by reverse osmosis. That's the best one to get. And, it's still in plastic, so it's not great anyway, but it's better. And I told her to take the Pedialyte out because she'd just be better off just having the reverse osmosis water with none of the other things they put in Pedialyte.
Yeah,
so,
we can add some of the good minerals.
Yeah, so, but that little girl, she just left so happy today. And, it's just the little things in life that give you hope and make you feel like, hey, maybe there is an answer.
Because we care, and there's many other people like you that do care, the ones that continue to send in people and refer people and to tell people to listen to our podcast. It's the caring that makes the world a better place. So y'all keep it up, and thank you very much, because we get a lot of pats on the back, too.
And speaking of these issues with adrenals, we're telling you all these things that are possible symptoms. Can you tell us anything that might help the adrenals, if they don't want to do lab work or...
you mean it's not coffee?
Well, if they have to have coffee, that might be a symptom. They need some other kind of help, because you'll notice the coffee doesn't really last for a long time. It's like, sort of, but then you feel really dehydrated.
Yeah, y'all that were listening, the last podcast, you heard me get choked on coffee last week. Some men, let me pick on men for a little bit. We're generally not as easy to treat as women. Women have a better connection with their body, and men are pretty much disconnected. So there's not many things that I actually can take and, oh my God, I feel better. I feel horrible if I don't take all this stuff, but I tell people I don't necessarily feel better until I quit taking it. And there's about 4 things that I can take and feel better. And since I did allow myself to get into adrenal exhaustion, Janet found this product. It's called Adrenal Response Complete Care. Now, I have trouble swallowing for other reasons I won't get into, but sometimes I just chew these nasty things up. If it's a tablet, I pretty much chew them up, no matter how they taste, because I'm more into the response. And she got me this Adrenal Response. And it's got the pantothenic acid, which is really the best B vitamin to rebuild and decrease stress of the adrenal glands. It's got the magnesium, vitamin C. It's got the ashwagandha, serene, reishi mushrooms, rhodiola, etc., etc., etc. I took those, and oh my God, I could not believe the energy it gave me within 30 minutes to an hour. And you don't have to take it forever. I'm still taking it, and it's been probably 2 or 3 months. I'll probably get off of it and move to another one within the next bottle or two. But this adrenal response is some really kick butt stuff. I love it.
It does seem like it's good to move it around. We've noticed it's like your body gets used to one thing, and changing it up sometimes kind of puts a little pep there, a little spark, or maybe you just notice it more.
It increases your body's range of adaptability. So when Janet naturally eats much more healthily than I do, and that's a generalization, but it's usually true more so of women. And so I say, well, I can have buttermilk pie or Snickers or a shot of whiskey because it increases my adaptability, the range of adaptability. And Janet looks over and says, bull. So you can't sneak one past her. So Brian down in Florida, don't have dessert. You're doing a good job. Thank you. We just celebrated our 1-year anniversary on Facebook. So you're doing a good job. And there's a lot of people all over the country that are doing good. So even people sometimes, they'll have the abdominal pain. They can have confusion because of the output of the adrenal glands is not correct. There's some people, they have loss of consciousness. I've seen it 2 or 3 times. And, the first thing I do is send them to the ER. Oh, and I'm supposed to get back to the D2 versus the D3. D3 is the active form. And, and I'm not knocking the medical profession, because Lord have mercy, they're very talented, they're very intelligent, they'll save your bacon. They're wonderful, but they're too blooming busy, and they have their hands tied by the insurance companies and big pharma. So don't knock your MD. When people come in and say, well, my MD, I said, I don't want to hear it. They're good people. Get off of it.
Well, that's what her question was. Why did they give her a prescription for D2, and over the counter it's D3?
And I don't know. I think big pharma controls what some people hear, and, we kind of practice how we're trained. Very few people think out of the box because we're too dadgum busy. I know I stay outside the box, which is one reason Janet was attracted to me, because I'm outside the box. But she also gets really frustrated and stresses her adrenals trying to keep me inside the box, too. So it's a two-edged sword.
We're forward thinkers, as we were told.
Yeah, we were told that the other day. I'm not sure that was meant as a compliment, but we took it as one. And see, that's another thing. No matter what happens to you, you can choose to take it in a positive manner or negative. We chose, and I really don't think that was a compliment, but we took it as such. So people that are slow and sluggish, think, well, your adrenals are probably cratered. Excessive sweating, especially on the face and the palms, can be a poor adrenal response, needing that.
Missed menstrual or irregular periods are also signs of an adrenal problem.
Yeah, and again, that goes back to metabolic syndrome and diabetes. That's a very good point. Some of the causes for all of these insufficient adrenal responses, sometimes it's an autoimmune reaction. We're getting more and more of that. We're seeing it more, and we're seeing it in younger and younger patients. And I personally think it's the food and the nasty stuff that's on our food, not just glyphosate. Monsanto's not the only one that needs to get their butt kicked. There's a lot of other chemical companies that deserve that, in my opinion. But check your immune system, which is something we can take a look at on our inexpensive blood work. Lack of sleep. And sometimes it's not that you can't sleep. It's just because you have that obsessive-compulsive behavior, type A behavior, and you push yourself too much. And that's because sometimes we connect who we are with what we do and what we accomplish. And, I get into that sometimes too. But even though, if you're exhausted, lay down and rest, because you can actually get more done if you take more time to do your R&R. Poor diet, Janet eats cleaner than I do, but I eat much more clean because Janet knows how to gently and very nicely motivate me. She said one time, Stephen, you're insured for a whole lot of money. She says, I'm young and hot, and I can get another man to spend your money. And that's but, okay. Yeah, that was gentle.
One thing I find interesting, people always say exercise, but you can actually over-exercise.
I'm all for that.
As much as you can lack of exercise, you can overdo it. I actually had a lady in here yesterday that's what she does. She goes from one exercise class to the next all day long. She's line dancing, she's jazzercising. She's doing all these things, and then she's like, I can't sleep. I cannot sleep at all. I said, let's go run your lab and let's see what's happening. But it's interesting to know that you can actually overdo it the other way.
Yeah, your body does need R&R, and I think in America we don't take enough time to really relax. And high levels of stress, any stressful experience like surgery, we're getting in some incredible, now we have them in, amino acids. I love this complex. It is the perfect ratios to regenerate after surgery or stress. And I've seen people that just cratered after they had a death in the family and, got depressed, adrenal exhaustion. I've seen some people that never came out of it. So if you have these bad things happen, reach out, but accept the help that people are willing to give you.
Okay, and we want to make sure we address your questions this week. I know we didn't get around to them last week, because we had our special guest, John, here that was on our show with us. And John Smith, thank you for coming. I know I can say your whole name because that's kind of cool because there's a million of you out there.
And I'm enjoying the kombucha, too. I'm having to learn.
But we do have some questions. And Michelle is one of those questions that was asking about, is there anything that you would recommend for trigeminal neuralgia? You probably have to tell people what that is to start with and what you would recommend. For people that have it, they'd like to know.
It's a pain going through the cranial nerve, but there's a lot of different theories on that. Some people think there's a viral pattern, and that's why I think lysine's a good thing. But for goodness sake, you have to get the good B vitamins, and I promise you people, most of these supplements aren't worth taking at all. So get some good B vitamins, especially B6, B12, folic acid needs to be the 5-MTHF type. Thiamine and riboflavin are very, very important, but they're very important also in thyroid function. So that being said, I think calcium and magnesium in a proper ratio is very important, and I've seen many people that got results just taking those things. And, according to the FDA, we can't claim this does anything for symptoms or diseases, but when you put it into the temple of the Holy Spirit, it's smart enough to do something with it and work for good. Also, chiropractic adjustments. There's plenty of well-done research that says an adjustment can affect the cranial nerves. And I wasn't taught that back in the 80s, but that's become true now through the research.
And we have a question from Lance that wants to know, how do the nitrates and nitrites interact with the body? He says, with most studies, like politicians, you get what you pay for. I've seen lots of money dropping on nitrate-free products that are made out of conventional meat. If I'm going to splurge on bacon, does it matter?
For some people it matters. For me, I think the stress of worrying about it's worse than eating them. But people say, well, they can trigger migraines and this and this and this and a histamine reaction. And they're right. But it's not that nitrates and nitrites are the problem. The problem is your lack of detoxification. And then, we had a lady write in that says they raise hogs to sell for health food stores, and sometimes the preservative salts, actually you get a higher amount of nitrates and nitrates than you do in the regular bacon. So if you're sensitive to it, think about revving up your detoxification pathways. We do have a couple of incredibly improved products coming from that. And we're experimenting, and Janet yesterday says, oh my God, I can't believe the detox that's going on in her body. And it's comfortable, but it's obvious it's dragging out things that should have been drug out years ago. So, we can increase your detox pathways. But if you're super sensitive to it, get to the root cause. And avoid it till you can fix the root cause.
And then we had Donald that wrote to us on Friday night that told us that his stomach was hurting because he had catfish, fried pickles, fried okra, and hush puppies. So he's been doing our products now for a little while, and he's actually beginning to correlate that when he eats incorrectly, he don't feel so great. So thank you for sharing that with us, Donald.
At least he's taking responsibility, but he's practicing because he's living in Iowa and he's about to move down here to Bloomberg, Texas. So you better learn to eat catfish if you're going to live in the South.
And Mexican food. And then we have Jerry that wants to know if anyone's had any success finding a cardiologist willing to work with you to get you off heart drugs. And if so, how did they find the doctor that would do that?
Yeah, good luck with that one. I went to a cardiologist once, and he says, you don't need to take all these supplements. You can get everything you need out of your diet. And I thought, holy crap, I need to get out of here. I'm paying this guy a lot of money to tell me stuff that's been obsolete for 100 years. I don't know the answer to that. I've never met a medical doctor or osteopath that didn't have good intentions. I've always thought they were very brilliant, although I don't always agree. But I think the best thing you can do is read the book, Is Your Cardiologist Killing You? And that way you can talk to your cardiologist, I think, in a very educated manner. And you still need a cardiologist. That's not what I'm implying by reading that book. But, you'll be able to ask them, well, what about my RBC magnesium? Well, what about this? And what about, do I need acetyl L-carnitine? And that's in one of the new things we're experimenting with that's, my God, it gives me incredible energy, and we're going to have it for you pretty soon. Acetyl L-carnitine is one of the major ingredients in this new product. It lowers your triglycerides 25 to 39% in 10 days, but it's also good for cardiac function. It's good for people with Peyronie's disease. It's good for people that have low sperm count. It's good for all kinds of things. and while it lowers your triglycerides, it doesn't cause any problems. It actually increases your ability to live or your chances of living. So I think you can talk to these doctors much more intelligently and have a good time with that one.
Well, and I don't think it's so much about them taking you off of the drugs, asking them to take you off of it, as it is you get healthier and don't need them, the drugs as much, because that's what's happening with my dad. They've taken off like 3 of his prescriptions because we keep working with him to get him healthier when he doesn't need the prescription anymore. So they can't argue with that because he's better.
And they're glad to do it, too. They don't put you on drugs because you don't need them. I mean, they'll take you off of them when you're healthy enough.
Right. And we would like questions for the show. We love your questions. We love ideas for shows. We'd also ask that you sign up for our newsletter if you're not already signed up for it on greenwisdomhealth.com, because each week now, as our products change, the names and what they used to be, we're going to put on that newsletter, because we can do it there, what the name of the product used to be and what the new name is now. So we're changing them slowly. So you'll have to kind of keep up with your newsletters and refer back to it. We're going to start putting things in your boxes when we get that made of what the new names are, so it'll be easier for you to find. You can become a friend on Dr. Lewis's Shootin' Straight with Dr. Lewis. That's where you can ask the questions. If you get lost with the product names, you can ask him there as well. He knows all of them as well.
Oh, you have such great faith in me.
And if you're new to the show, we'd ask for you to go fill out the health survey on our website. And that's how you get started. It will recommend a lab panel for you. And the consultation with Dr. Lewis is free when you pick the lab that it recommends. So there's different ways to get a hold of us. There's people doing different things that's been with us a long time, and there's new ones. So there's a lot happening. We have a lot more exciting things coming down the pike. So hang in there, because it's not just the products that are changing. It's some other things as well.
Yeah, and you can look on Shooting Straight with Dr. Lewis and see great, healthy recipes from Tara. They're absolutely incredible, although I guess I have to get up off my low adrenal and get up and cook them. They're awesome, Tara. Keep them coming.
But thank you again. We hope you've learned something this week, and we look forward to being here again with you next week on the Green Wisdom Health Show.
Once again, our show has come to an end, but your hope in your health is only beginning. If you or a loved one are in need of a different outcome and are waiting for a brighter future, take the first step and go to our website and fill out the health survey. Please don't keep us a secret. If you know someone that could benefit from this podcast, please share this show with your friends and family. You are only one step away from a life worth living.